Let's see how Clarius HD is used for high-definition musculoskeletal imaging and diagnostics, and also how it facilitates better outcomes in procedures for pain management. The CDC tells us that 1 in 5 adults is suffering from chronic pain, and as clinicians, one of the most common concerns we encounter from our patients is musculoskeletal pain, both acute and chronic. For years, injections for pain relief were delivered blind, resulting in inconsistent pain relief. In a recent webinar poll, we learned that 69% of physicians believe inaccuracy is the most significant risk in injecting blindly, and they're right. Research studies have proven again and again that using ultrasound to guide our needles drastically improves our procedural accuracy and precision, allowing us to put our needle where we want it, avoid surrounding structures where we don't want our needle, and watch our injections unfold in real time. The research tells us that ultrasound guidance of even our most common knee injections resulted in better accuracy than performing them blind, at a rate of 96% versus 78%. Even more telling, imaging guidance improved the accuracy of the more technically challenging intra-articular injections of the shoulder to a 97% success rate versus 65% when performed blind. Another review of 13 published studies proved that the enhanced injection success with ultrasound guidance directly improves patient-reported clinical outcomes. Ultimately, practitioners and their patients experience better successes, fewer treatment failures, and fewer complications. In our model here, let's look at the anatomical target we're trying to hit for a common knee injection. When we used to do this blind, we got desensitized to our patients experiencing pain because my needle would have to come in, and I got used to scraping bone or cartilage or some of the other soft tissues. But with ultrasound guidance, we can transition where we do our procedures here to something like the suprapatellar space, where now I can inject directly into a potential space. And I know that an injection should be painless into a potential space because there are no nerves in the joint space itself. If the patient is experiencing pain, it's because I missed. Let's see how this is done by Dr. Alan Hirahara, who's board certified in both orthopedic surgery and orthopedic sports medicine, but he also holds a black belt in ultrasound-guided procedures.
Hi, I'm Alan Hirahara. We're going to be doing an injection using ultrasound. We'll be doing an injection of hyaluronic acid into this left knee for a male who has degenerative joint disease and is trying to get some relief from some of this lubricant. So we'll be doing this under ultrasound guidance using this Clarius device, L15. There we're seeing very nicely. And we can see very well. He does have an effusion, so we'll be able to give an injection directly in that effusion. You can see it's about 1.5 centimeter entry point and then angled slightly down to get into it. So now we're going to get him cleaned up. Okay, I'm going to numb it up. Prepare for the injection. We're going to put this on, make sure we're in the right spot. We're happy with our positioning. There's a good spot. Take a picture for recording the video and then entry. There in the right spot. Yep, in the right spot. There we go.
Dr. Hirahara makes it look easy. This suprapatellar approach is really only possible with ultrasound guidance, where you can easily visualize a track directly into the joint space without obstruction by any bone or cartilage.
My name is David Rosenblum. I'm the director of AABP Integrative Pain Care and Maimonides Medical Center's pain service. I'm a regional anesthesiologist, and I specialize in ultrasound and fluoroscopic guided interventional pain procedures. I use ultrasound to perform regenerative medicine procedures such as platelet-rich plasma, bone marrow aspirate, as well as radiofrequency ablation, cryotherapy ablations, and other nerve blocks and injections. Using ultrasound has improved patient trust in a variety of ways. First of all, they see that I am doing something under visualization, direct visualization. I could see the structures. I could even show the structures to the patient and let them see the needle target the tissue. It inspires confidence because not every physician is using ultrasound yet. And when the patients see that I'm using such a high-tech, newer model as the Claris V2 or V3, they tend to be amazed by the product and what it can do. When colleagues ask me about the Claris ultrasound, I highly recommend the product. I think it's great. It's helped to create a high-volume interventional pain practice in which I'm able to do lots of procedures in a safe manner in a relatively short period of time.
Orthopedic surgeons like Dr. Hirahara, pain management experts like Dr. Rosenblum, emergency physicians, and general practitioners alike are coming to rely more on ultrasound to guide injections, with many calling it the new gold standard. What's also great to see is how patients themselves are reacting.
My name is Eileen Calandra. I'm a retired teacher. I've always been very active, always lived in a walk-up New York City building, able to run around and do everything. This impediment with the severe pain has really set me back. Dr. Rosenblum was recommended by my primary care doctor because I had this sudden onset of debilitating pain, almost unable to walk. And I came here to Dr. Rosenblum, and he used a procedure on me 6 months ago where I just skipped out of the office and been on my way ever since. It makes me feel very confident because I'm aware the ultrasound system is guiding him when he's administering the pain-relieving medication to my foot. I believe it improves the care because it gives an extra benefit to the doctor rather than just guessing as to where he should administer the pain medication. I think the ultrasound gives him a perfect guide to where to administer it.